We're joined now by Professor Sharon Lewin, who is co-chair of this year's AIDS conference. She's a leading infectious diseases physician from the Alfred Hospital and Monash University here in Melbourne. Professor Lewin, thanks very much for joining us.
Pleasure.
I wonder if you could just bring us up to date, I guess, on the current state of HIV research and what are the most promising areas for finding a cure for people living with HIV?
So HIV research has really changed over time. In most recent years, we've seen the need for operational research, making sure that what we're doing in the field actually works. For many years, we've been doing clinical research, identifying new drugs that control HIV. More recently, the big focus is on complications of long-term treatment in patients, such as diseases of aging and cardiovascular disease and cancers. There's been a very significant change in prevention research, a lot of new ways to prevent getting HIV beyond condoms and behavioural interventions. But in the laboratory, which is really where my focus is, the big two questions still are on finding a cure and finding a vaccine. And vaccine research has been very, very intense, really from the beginning, because that's the traditional way that we usually combat an infectious disease with an effective vaccine. That's proven to be quite difficult. I think we have made advances. We have a much better understanding of the way the immune system controls or protects someone against HIV, but we still don't have a really effective vaccine.
And how could we step up the pace in terms of finding these viable treatments?
Yeah, well, there is, of course, always money helps. That certainly fuels things. I think, but more money doesn't mean that you solve big problems. I think other ways to solve these really big issues, like a vaccine or a cure, are around collaboration. So getting large teams together, and we're seeing a trend in that approach, both in the vaccine world and the cure world, of getting big teams across multiple laboratories, multiple countries even, and finally engagement of the private sector, which again we have done moderately well in HIV. Certainly the discovery of antiretroviral therapy, involvement of big pharma was really important. Big pharma have been involved at different times in vaccine research, less so in cure research, and of course philanthropy, Gates Foundation, AMFAR, etc.
So how has that, I guess, changed the sort of funding model for HIV research?
Yeah, I think that we need to think of new ways to innovate in funding research, biomedical research. Of course, governments are responsible for it, but I think we can be more creative in working out new ways to fund and collaborate.
And I guess that highlights the importance of a conference like this in terms of highlighting the need for that investment.
Conferences like this are incredibly important to get the message out loud and clear to the community and government of the real issues that we are fighting and the real needs. They're also really important in getting people together from diverse groups, such as government, industry, academia, but most importantly community. I mean, community partnerships have really driven change in the HIV response, and they're going to be just as important in driving the science.
Well, Professor Lewin, I know you've got a busy schedule, so thanks very much for joining us on the program.
Pleasure. Thanks very much.